And good evening, everybody. Welcome to our second town hall in our series of town halls. We have with us right now Council President Nick Mosley. We also have Dr. McDowell from the Baltimore City Health Department, and we have Dr. Lewis Saint, who is the Executive Director of Healthcare Ready. We expect to be joined shortly by Dr. Galia Satos from Johns Hopkins University. And so what I'm going to do is I'm going to give some brief bios. Then I'm going to turn it over to the Council President for some opening remarks to ride through, and then we're going to get moving. So first up, we have Dr. McDowell, and I'm going to preface this by saying I cannot do justice to everybody's bio because it is just so much information, so much great stuff that they are doing. But Dr. McDowell has joined our health department as the Chief Medical Officer, and she has been with us since October 2020. She's board certified. She is a CDC-trained medical epidemiologist. Prior to joining the health department, she went through their intelligence service fellowship, and she has also been with the implementation unit within the health systems coordination team in the CDC. She's been part of the COVID-19 response structure. She has received her bachelor's in biology and religion from Swarthmore College. She also received her medical degree from Mount Sinai School of Medicine, and she has a Master of Public Health from Mailman School of Public Health at Columbia University. She's very well credentialed, and we are thankful for her and her service here in Baltimore City. I will do Dr. Lewis Saint right now, since we don't have Dr. Galia Satos yet. And Dr. Lewis Saint, she serves as the Executive Director of Healthcare Ready. That's a nonprofit where she works to meet the most pressing needs of patients before, during, and after national disasters, disease outbreaks, or other catastrophic events. Prior to joining Healthcare Ready, Dr. Lewis Saint was the Senior Advisor to the State Department. She has worked on Ebola epidemics. She has worked with FEMA. She has done so much, but here is the real meat of her resume, and I've been passing this around to everybody. She holds, she has Bachelor of Science degrees in Chemical Engineering and Biological Sciences from Carnegie Mellon. She has her PhD in Pharmacology and Molecular Sciences from Johns Hopkins University. She holds an MBA from the University of Baltimore. And if that is not enough, she went back for more punishment to do some postdoctoral fellowships at Johns Hopkins and the American Association for Advancement in Science. So we are pleased to have these two dynamic doctors with us. And last but not least, we will read off Dr. Galia Satos' resume. He's the Assistant Professor of Pulmonary and Critical Care. He is the co-chair of Johns Hopkins Health Equity, Office of Diversity, Inclusion, and Health Equity. He is the co-director of Medicine for the Greater Good. His clinical responsibilities include being the director of the Tobacco Treatment Clinic at Johns Hopkins, the associate director of the Hereditary Center of Clinical Excellence. He is a physician of the Obstructive Lung Disease Group at Johns Hopkins, and in his spare time, he is also on the teaching faculty of Johns Hopkins School of Nursing. So with that, I'm going to turn it over to our council president to get us started.
Well, thank you so much, Mr. Derek Green, for that warm introduction, as well as reading those amazing bios. You know, when we talk about the city of Baltimore, we are not without talent and amazing individuals that do amazing things, not just for our city, but for this country every single day. And this is just a small reflection of that. So first and foremost, thank you to the panelists for joining us. To the citizens of Baltimore, thank you for tuning in. Again, as Derek stated, this is our second of many town halls. What we try to talk about is current events, things that are impacting us. And we know that the coronavirus has been around for quite some time. And because of it, you know, many of our behaviors have started to kind of normalize back. Maybe we're not washing our hands as much as we were at first. Maybe we are wearing our mask just around our mouth and not around our nose. Maybe we're going out with some friends and enjoying libation, but getting a little bit too comfortable and not really respecting social distancing. And we have to understand and know that this virus is still here, that many folks are still being affected by it on a daily basis. People are fighting for their lives, and that we're still seeing deaths. Even as we've gone down this path of vaccinations, and we're going to go over the numbers in a second. So this is really just to say, hey, let's level set, let's take a step back, understand and know exactly where we are right now, and, calling a level of urgency to the things that we should be doing. And that's why I reached out to some of the best experts that we have in our grasp that are related to the city of Baltimore, so you can hear folks who are connected from a cultural competency perspective to our needs, but also have the background and the subject matter expertise to break it down to us. So that's exactly what this is about. So, Mr. Green, if you could jump right into the slides, we're going to just look at Baltimore by the numbers real quick. Again, this virus is still here. The rate is still increasing, and I do not see it yet. Is it up yet? It's coming up. Here we go. All right, so cumulative COVID case rate and death rate, death data. So we know that we had over 470,000 cases. This is inclusive of last year and year to date this year, 881 deaths. But this is the key, and this is why we highlighted this, and this is exactly why we're here talking about it. We've seen a 162% increase in COVID-19 cases in the last month here in Baltimore City. We've seen a 162% increase in COVID-19 cases in the last month within Baltimore City limits. This is data that's pulled from the Baltimore City dashboard. So Derek, if you could jump into the next slide. Now, we've seen these numbers, and, many folks know that when it came to, and I'm going to get into a specific story with Dr. Lewis Saint later, but many folks know that when I was in Annapolis as a delegate, really pushed on the state government to start disaggregating the data to try to understand and know where the testing was being completed, who was being affected by this virus at the time. And the same thing has kind of happened as it relates to now when we're talking about not only folks being affected, but who are getting access to the vaccination. So we're going to talk about equity on this town hall as well. But we know Black residents comprise about 63% of our population, and Latinx is about 5%. That stated, Black residents comprise about 73% of the total COVID deaths and 64% of total cases. Again, outperforming, unfortunately, the population. So it's disproportionately impacting communities of color. Latinx residents are experiencing 10% of the cases. Again, they're making up 5%, so double the percentage associated with what they make up here in the city of Baltimore. Derek, next slide. Now, it's important for us to call out the areas that are being impacted the most, and these are the zip codes, 21226 down in Curtis Bay, 21225 Brooklyn Park, 21209 Mount Washington, Cold Spring, Glen, Falstaff, and the Cross Country, 21205 Monkford and Orangeville, 21202 Penn, Fallsway, and Old East, and then 21239 Lock Raven, Chinquapin, and Idlewood. Again, I think that, there was a lot of misnomers when it originally came out. This was a thing that could only affect folks that had pre-existing conditions. This only affected our elderly population. But when we really start to disaggregate and look at the numbers, it becomes really scary as it relates to some of the folks who have been significantly impacted by this, by their age, by their prior or lack thereof health conditions, and also sometimes by their specific activities. So again, this is why this is so important that we're here to talk about this. We cannot normalize where we are from a COVID perspective. And again, that's why we have these amazing panelists on. Derek, the next slide. So we're going to go through this real quick. Again, 184,000 Baltimore City residents have received the first dose, first or the entire dose of the vaccination. 115,000 residents are fully vaccinated. So about 20% of our population here in the city of Baltimore is fully vaccinated. Individuals have received COVID-19 vaccines for a first or single dose within Baltimore City that are Baltimore City residents are 35%. So that's basically the dosage that the health department are administering. We're also starting to keep track of how many of those dosages are going to Baltimore City residents. 12% of Black residents have been fully vaccinated compared to 27% of white residents. Again, talking about equity, we spoke about it as it relates to treatment of care, as it relates to testing, and now we're talking about it again from a vaccination perspective. I'm sorry, Derek, you moved on the slide. And then last two stats, 36% of Baltimore City residents between the age of 35 and 59 have received their first dose, and 21% are fully vaccinated. And 31% of Baltimore City residents between the ages of 20 and 34 have received their first dose, and 19% are fully vaccinated. Now, you know that we've moved into step 3 that has opened up for younger folks. And as we know, phase 3 has opened up for younger folks. And as we know, this is not a virus that's only impacting older Baltimoreans, older Americans, but also our younger folks. And we've seen a significant increase over the past couple of weeks specific to that. So outside of me butchering up all of the data and all of the stats, we're going to jump right into the experts, the folks who work every single day on the front lines to ensure that Baltimore City, to ensure that America and Americans are protected as much as possible, and we kind of fight and get ourselves out of this. So first, because we just went over all the Baltimore City stats, I'm going to turn it over to Dr. Kendra McDowell. Again, she is the Chief Medical Officer of our amazing Baltimore City Health Department. So Dr. McDowell, if you could kind of give us a synopsis of where you are, what you've been doing, and any tidbits that you would like to communicate to Baltimore City residents today.
Great, thank you so much, Council President Mosby. You went over a lot of the stuff that I was going to go over. So
but you're going to break it all down for us. I just regurgitated numbers, but you're going to lay that context in it for us.
So what I was, as Council President Mosby mentioned, getting vaccinated, continuing to mask and social distance is how we will get out of this pandemic and in this pandemic. The health department, as you are probably aware, is coordinating with partners, multiple healthcare and community partners, to reach the city's goal of vaccinating at least 80% of Baltimore City residents by February 2022, so in a year. Currently, as mentioned, almost 190,000 residents have received their first or single dose of COVID-19, and 1 in 3 have received their first dose and 1 in 5 are fully vaccinated. This is excellent news, but as mentioned, we still have work to do ensuring equitable access and administration of the vaccine. And this is a key priority of the health department. What is being done currently is in regards to ensuring that equity. We have seen, as we saw, the disparity between African American population in Baltimore City and the white population in Baltimore City in regards to the percentage fully vaccinated and also receiving their first dose. That is now, it's a twofold difference. It is a decrease from a threefold difference from earlier on. And the way that we are closing those gaps is by following the data. So looking at our neighborhood level data on what neighborhoods are being vaccinated in terms of the total population. Right now, as of yesterday, everyone in Baltimore City is eligible to get vaccinated. So we are strongly encouraging individuals to sign up at covax.baltimorecity.gov. Because we really need to spur that demand. There is demand there. We want to increase the demand, particularly in our younger populations where we're seeing the case rates now. So the 20 to 50-year-olds, the middle-aged individuals. And so in addition, as many have known, we have mobile response teams. We're bringing vaccine to the community. There have been over 70 events where vaccination right now has been focused on mainly our senior housing sites and also individuals with disabilities. But as we have eventually have reached all of our senior housing sites for vaccination, come mid-April, actually come now, we are going to be transitioning to mobile response teams that are going to be partnering with community organizations. And that is being done through our work with the community, particularly communities that have been disproportionately impacted by COVID-19. At the health department, we have value communities. These are communities that have been disproportionately impacted, communities that have higher barriers to access. And there are about 9 of them, which I won't go through all of them, but there are about 9 of them. And we specifically focus on those communities, the barriers, and also the community partners that know the community so that we can partner with them to bring vaccine to those populations and to those groups. So that is definitely a big part of our work. We also, in terms of decreasing barriers and increasing access and equitable access to vaccine, we know that there are a number of city residents that are homebound, that cannot leave their home. And we are working with our hospital partners and also eventually with the health department to roll out vaccination, where we'll be bringing vaccine to those homebound individuals that cannot leave their home to get vaccinated. So those are just a couple of things about where we are. There's some really great things that are going on in terms of listening sessions as well. That is informing. We're actually having 2 listening sessions this week with young men and then also people experiencing homelessness. And that is informing our educational materials, information that we put out there to ensure that it's culturally, competent. It also resonates with individuals, and we are hitting the mark and addressing the barriers that certain populations might experience. So we're having those listening sessions. We've had now over, I believe, 11 listening sessions so far with our value communities, and that is informing the communications that we're putting out. It is informing also the partnerships that we seek out as well, and where we will go with the vaccine. In regards to where we are going, we are on track, but we need to do, of course, we can do better as a city in terms of vaccinating. And that is going to continue with our mass vaccination pod, with our mobile response teams, with our homebound work, and also our community pop-up vaccination work as well. So expanding the access points where people can get vaccinated throughout the summer, we will be seeing a shift in how we are delivering vaccine and getting vaccine to the community. One last thing that I do want to mention before I jump off.
Okay, all right. Before you jump off, no, you're gonna stay on with us for a little while, right?
Okay. Yes, I'll be here.
All right. Don't jump off. We're just making sure.
Definitely not. But one last thing that I do want to mention, and Council President Mosley, you mentioned this as well. So that 36%, that is the entire vaccination kind of ecosystem within Baltimore City. So there are multiple people that are administering vaccine, not people, but organizations, our mass vaccination sites through the state, our hospital partners, our pharmacies, the health department. And so when we, on our dashboard, we're actually able to track out of all of those vaccinations administered in the city, what percentage are being administered to Baltimore City residents. So we do track that on our dashboard, and it's about 36%. But what we are doing to increase that as well and to increase access to our mass vaccination sites is the health department is partnering with mass vaccination sites, partnering with our hospitals as well to prioritize Baltimore City residents that we are specifically through our covax.baltimorecity.gov registration system or signing up. and also signing up through our MAP hotline as well. People can call and sign up for those appointments if they're 60 or older, or if they have disabilities. We are working with them, with our mass vaccination sites throughout the city, to ensure that Baltimore City residents get first priority in getting those appointments at the mass vaccination site as well.
Yeah, and I want to thank you as well as Dr. DeRaza, the Health Commissioner for the City of Baltimore, for all the work that you've done to kind of make up that gap. I know, when we were first rolling out, there were challenges all across the board, challenges with the state website and challenges with just deployment, and we saw numbers that were really scary. And I think that you guys have done a tremendous amount of work over the past couple of months to ensure that Baltimore City residents have access. And I'm thankful for all of your commitment, your leadership, and a lot of the ground you've been able to cover over the past couple of months. So thank you. Next up, we have Dr. Lewis Saint, who many of you, if you've ever watched any programs in this area about COVID-19, have probably seen her. She always does nothing but lay out jewels. My experience with Dr. Lewis Saint, and she probably doesn't remember this, but I do, I had the fortune of talking to her in early February 2020. And when COVID-19 was just like a blip across the screen, particularly talking about what was going over in Asia and then what kind of started in Europe, this sister right here was like, Nick, it's coming and it's going to be severe. She said all the modeling that I've seen, presents a lot of challenges. And I don't tell people this, but I was the conspiracy theorist to all my friends, family, colleagues, and folks I talked to, because I regurgitated, I said exactly what Dr. Lewis Saint told me, and they would not believe me. And I never told them this, but when they came back to me a couple months later and they said, Nick, you are so smart. How did you know that? I'm publicly saying it was because of Dr. Lewis Saint. So Dr. Lewis Saint, the Executive Director of Healthcare Ready, thank you for coming on and joining us. Really interested to hear your thoughts of like where we are and where we go next from here.
Thank you for having me.
And could you also tell us, Healthcare Ready?
Sure.
What does it mean? How does all the amazing Black Girl magic kind of work together? So let's get into that.
So thank you for having me, first and foremost. I do remember standing in a corner in FEMA on the phone, I don't know how long the service is going to last, but this is what's going on. So I'm very pleased to be with you guys, and always happy to do anything for Baltimore City and Baltimore City residents. I serve as the Executive Director of Healthcare Ready, which is an organization that was actually founded shortly after Katrina. So our focus is making sure that there are partnerships in place between the public and private sector that reach all the way down to community to make sure that we are prepared, we can respond to disasters, and most importantly, we're able to recover in a way that makes us more resilient for the things that will come next, knowing that for many communities, the idea of preparing for a disaster is a luxury. So we have to do the work of making sure that we are preparing and making sure that we can be that safeguard for communities, knowing that disasters like COVID will come. So, as you say that, Nick, I do think about how long it's been. We've been activated for COVID since November of 2019, actually, recognizing that at that point it was impacting the Hubei province in China, and little known fact to most people, but normally the bump up in production that happens to make sure that we have the medicines and supplies that we need would happen in that November-December window, knowing that in that region they would close down for the Lunar New Year. So we saw it as an immediate concern related to supplies and PPE and medicine, but also recognizing that there was pandemic potential and we needed to prepare. One of the biggest challenges that we've seen over the last year, and I just want to, publicly thank then Delegate Mosby for the work that he did in pushing for demographic data, because really when we were beginning to really tackle this, we had a really difficult time understanding who would be impacted by COVID most severely. And part of that is because we weren't collecting the data. What we do know is that Black people have been most severely impacted by COVID. We also know that there is, for most disasters, a disproportionate burden on people of color. That has been true for many disasters. And so how we respond to this and how we get out of this and making sure that we're recovering in a way that is actually restoring and making sure that we are making those communities of color more resilient is equally important. As we have gone through the arc of this, part of our challenge has been our rush to normalcy and what that means for how we are working towards reopening commerce. What does that mean for people who do not have the option of staying home? But also, what does that mean as we're rushing to go back to the mundane things in our lives, being able to have barbecues with our families, being able to see people for birthdays, being able to go out to eat. So as we are talking through the vaccinations, it is important that we're looking at this from the vantage point of moving from just having vaccines to being able to actually get vaccine in arms and real vaccinations, but also understanding that that's a part of the arc. So you doing your part as a citizen and getting that vaccine is a piece of it, but that doesn't mean that the pandemic is done. As one of my colleagues loves to say, we may be done with COVID-19, but COVID-19 is not done with us. So we have a lot of work to do to make sure that we are really getting through this pandemic. Those of us who have been studying pandemics for a long time know that it takes a few years and then we'll be in recovery. So while we are fatigued, we do have to figure out ways to work together and get through this phase, understanding that the vaccination is an important step, but we still have a lot more work to do.
No, thank you for that, Dr. McDowell. When we talk about Baltimore City's response, what do you think is like still the biggest challenge of communicating the message to our city residents, getting our city residents engaged, identifying areas of opportunity of support? Like, what is still like the biggest pressing challenge on the health department right now that maybe some of the listeners out there, or even myself as an elected official, can do better in spreading this message throughout our community?
Yeah, I think, you know, and Dr. Louis Saint. I wanted to say Toussaint. Dr. Louis Saint really kind of hit on this a little bit. Is one of the big challenges is around, I believe, the fatigue. In terms of how are we messaging out? People have heard the messages, right? We've been hearing it for an entire year. And I think that we got to a point where people were masking, we're social distancing, but we just have to keep that right now. And that is, it's not packaged tightly because it is human behavior. And we know that it takes time to change that behavior. But the biggest messaging point is we have to continue to do what we've been doing for the past year, to practice what we've been practicing. With the vaccinations coming on, even with some of the changes in guidance that we're seeing, we know our community the best. We know what our needs are the best. You highlighted the data earlier in terms of where we are right now with the increases in cases. So the messaging really is get vaccinated, because that's what's going to protect us, and also continue to mask. Just keep on track of where we are. And that is a challenge. That's something that's very challenged to message. I think we as a city, as a state, and also as a nation have been trying to message this for the entire pandemic. And yeah, that's where we are right now. Just continue to do that. Another piece of messaging is that the vaccine is available. It's here. It is here right now. So sign up for covax.baltimorecity.gov. If you sign up, you will get an appointment. We have supports in place. If there's transportation issues, we have our barriers, we have those supports in place. So we will take care of that as the health department. But, you know, signing up is key in getting vaccinated, because the vaccine is here. It's open to everyone.
Now, when we talk about it's open to everyone, real quick, you know, very early on, many people talked about the hesitancy here. And many of my partners in government said that was related to yes, the low vaccination rate here in the city of Baltimore, but that just wasn't my shared experience. You know, I was getting seniors that were constantly emailing me or stopping me on the street saying that they really want to have access to the vaccination. But as it relates to that hesitancy curve, we know that there is a percentage of the population that's there. You know, what can we continue to do to kind of get the message out to folks who are ripe and ready to get the vaccination? But what are the other things that we also can do to try to get to the folks in the segment of the population who still have some level of reservation associated with taking the vaccine? That was for you, Doctor. Are you going to take that, Dr. Lewis-Saint?
I can start and then
go ahead, jump right in. And Dr. Gaglia-Satos is on as well, so we're going to go to him next. But go ahead, Dr. Lewis-Saint.
So I think one of the things that we've seen is that there were people, about 24% specifically of people of color, said they didn't want to take it first. And so learning more about the shared experiences that people have had in their vaccination experiences has begun to make people more open to getting vaccinated. But also part of the challenge has been communicating how we've been able to move along the pathway, because we started from a place of scarcity and now we're at a place of abundance when it comes to the amount of vaccine that was available. And that was a part of the challenge. When we were at a place of scarcity and we're working through the phases, there were a lot of people who were clamoring to get there, and then because of frustration, they might have felt discouraged. So it's about trying to figure out how to get them back. And I think, you know, the city's been doing phenomenal work, and not just trying to bring the vaccines and telling people to come to the vaccines, but figuring out strategies that bring the vaccines to people. And that is a part of making sure that we are breaking down those barriers.
Thank you. Now, Dr. Gaglia-Satos, am I saying your name right? I don't want to butcher your name. I want you to correct me.
No worries, Councilman. So Gaglia-Satos. Gaglia-Satos.
Is that good?
It's perfect, my friend.
We're good. All right. Now, every time we're on together, I absolutely enjoy it. I know you're a son of Baltimore, and you're also on the front lines. The one thing that many people, particularly younger people who might have had COVID, said, well, hey, it's an older issue. It doesn't really affect me. If I get it, I'll be fine. I think what we're seeing now is many folks who sometimes get it and recover from it, but are still having lingering issues. I know a guy, he's 43 years old, went through COVID, did the quarantine, and then shortly after, he developed a very severe case of pneumonia, and he's in the hospital, has been in the hospital for almost 2 weeks. Can you talk to us about that? Because I guess back to Dr. McDowell's point, there's just been this normalization associated with COVID, particularly of our young folks, that, hey, I'm invincible. And we were all 20 and 25 in our lives, lifting weights, playing basketball, doing any and everything on a daily basis, but we're not invincible, particularly as it relates to COVID-19. So being on the front line, can you kind of walk us through that?
No, of course. First, actually, I want to say something that I've been saying for the last year when we engage with the community, and I think that's a lot of times why our paths cross. Your doctors and nurses, I like to think of us as your last line of defense. If you got COVID-19, we're it. We're the last group. The front line is actually what you're allowing us to do now, to promote health and prevent disease. So to me, front line is the 8th grade student who we just talked to today down at Stuart Hill Academy, you know, to all the way to the 12th grade student at Mercy High School. Like, those are the frontline people. They can promote health and prevent disease. I'm your last line. Now, taking that information, let me actually tell you, in this pandemic, I'm a lung and critical care doctor. I thank you for all the accolades you discussed that I have. I think the most important one is I'm a son of Baltimore, born and raised, even though Johns Hopkins rejected my mother when she wanted to have me. But now I'm back as faculty there, so the irony. With that said, the hardest I have worked in this pandemic were the last 2 weeks. 14 days straight in the COVID ICU. The oldest patient I had in the ICU during those 2 weeks with COVID was 47. Last year at this time, the youngest patient I had was 52 when I look back at my notes. This is really pivoted. We have done a great job to protect our older citizens or older persons in Baltimore City. Right now, I'm seeing a shift in my intensive care units of young individuals struggling with COVID-19. Not a bad cold. I mean, life-threatening where they don't know, we don't know if they'll regain their quality of life after they leave our intensive care units. It is really shifted, and I recognize this is a bias of just what I saw in my ICUs, but usually that tends to reflect what is happening across Baltimore, if not across the U.S. So this notion, I know we have COVID-19 fatigue, but at the same time recognizing that the shifts in demographics around age is palpable. And we are seeing that both in the intensive care units, and then when I leave and do clinical work like I did today, I see it in my outpatient, right, where I'm seeing young men and women struggle to regain their life, right? We had a linebacker from the University of Michigan lose 150 pounds during this time post-COVID-19, still struggling to regain that back. In my clinic today, spoke with a patient. He has COVID back in the fall. He still is not back to his baseline. I encourage all of you, look at the WMAR interview we did with one of my patients, Calvin Mahoney. We talked about his story. It's been a year since he feels like he can't get his life back, right? And he's a young man struggling now with mental health consequences from COVID, in addition to still physical ailments. This is not an older person disease. This strikes, and right now, especially with the variances, seems to really be striking the young much more severe. So I thank you for having us, and from my standpoint, I agree with all these other amazing healthcare professionals who are emphasizing we can get fatigued, Mother Nature does not, right? We have to step up. We are amazing in Baltimore City. Love the city. It has always shown it's the best, and that's why I thank you, Councilman, for having us, because through this conversation, we can help our youth find that extra energy to kind of make it to the end zone.
Yeah, the idea is hopefully that this discussion is literally like a germ, and folks are here listening, and they take the information and knowledge that they learn from these amazing subject matter experts, and you talk to your family members, you talk to your loved ones, you talk to your neighbors, you talk to your coworkers to let them know what is really, really going on. I think many people throughout this entire process have really never really paid attention to what are going to be the residual effects of when you contract COVID and how it will impact your lives. And that's why I think it's really important to kind of talk about that. I want to open it up because, many people start to hear about this thing called variants, right? And how the virus is like mutating and changing, and maybe the outcomes and the impacts of folks have changed over the past year. Who would like to take a stab at really communicating what a variant means? How do we track those variants? How do they affect current medical care that we have today associated with COVID? All right, nobody's going to jump in there? Listen, I know you all are clamoring at answering because you all are so ready to answer it. It's so funny to watch three doctors say, hey, no, I'm just going to let somebody else answer this. I'm not going to answer it.
Councilman, I think select one of us and we'll go and answer. So you got to lead, my friend. We're too altruistic to kind of take the lead.
The camera's on you. You're on the front line. Talk to us about variants.
Yeah, so from my standpoint, I remember one of my virology colleagues, he goes, mutations and variances are just like the offspring of viruses. Like you're a mutation of your parents. I was like, that is not the most humbling way to put as a child, right? So viruses mutate. That's part of their biology. I mean, when the vaccine scientists, began working on a vaccine, they knew the virus that they were going to work with is going to be different in a year. So you try to select that protein, that structure that's not going to change that much. Mutations happen. It is part of the biology, right? I call them kind of, as they said, the offspring of viruses. Technically, I'm a mutation of my parents. We're genetically different, just not different species. And so we track them in order to provide us a variety of insights to kind of understand, the path of how this virus is evolving and so forth, and to make sure and assure us that our interventions are still working, whether they're interventions in the ICU to the vaccines for prevention. So from my standpoint, I want to use this moment to emphasize mutations, to discuss that. If you're worried, if you're sitting there being like, the only time I've heard of a mutant is in the Marvel Comics universe. Now we're here. If you're that worried, the best way to stop mutations is to not spread COVID-19 and to not get COVID-19. So it reaffirms everything my colleagues have been saying, to not get fatigued, to not let our guard down now.
It also goes back to your point of really trying to get all the information and knowledge to the front line, that you're the back line, that you are the last course of action that anybody should see, but we don't want folks to get to you. We want folks to kind of understand and know the knowledge up front. Dr. McDowell, from a city perspective, are we seeing any of these variants? What are the things that like the health department can do? What are the things that Baltimore City residents can do? Can you just talk to about the variants specifically to Baltimore City?
Yes, definitely. So as you know was explained earlier, the variants are it occurs, and basically mutations do occur with viruses in general. However, what can happen is when the mutation occurs, sometimes the mutation doesn't really change the characteristics of the virus to the point where it's going to cause the virus to have increase, be able to spread more easily. Sometimes it does. So what we are seeing throughout the United States is these mutations, specifically the UK mutation, is predominant, and we're also seeing that in Baltimore City. So the UK mutation, B117, is being seen in Baltimore City, and we have seen a few cases of the P1 mutation as well. That is the one from Latin America. We did know, the modeling showed us that we would expect to see a predominance of the UK variant across the U.S. And we're seeing it now in Maryland. We're seeing it now in the city as well. In regards to what can be done, the biggest thing that can be done, these mutations occur because the virus is spreading from one person to the next. The virus cannot live outside of what we call a host, which for the most part, our human bodies are the hosts now. So the virus has to go from one person to the next. When it is in our bodies, it starts to multiply. When that multiplication takes place, it goes from 5 to 100 to 100,000 to 1,000,000 and even more. When that takes place, that's when the mutation takes place. So if we can prevent that transmission, that spread, the virus cannot get to the next person and cannot mutate. So what we can all do and what we're doing in the health department is continuing to promote what has, the communications and finding more creative ways to communicate the need for us to continue to mask, to social distance, to stay away from large crowds, and to get vaccinated. That vaccination is the key to us, one, reducing the spread. We do have some evidence now that with vaccination, it does reduce the amount of the amount of virus that is in our bodies, and therefore decreases the chances of it spreading from one person to the next. So vaccination and masking is what we can do on a personal level, and also vaccination. And as mentioned, I don't like the phrase getting vaccines into arms because it's kind of impersonal, but having people have access to the vaccine and the opportunity to get vaccinated is what we are pushing at the health department and promoting at the health department and coordinating at the health department, and also that messaging around masking and social distancing.
Now, I'm going to jump in real quick, before you go on. We have a couple of questions, and one I think piggybacks nicely off of what the doctor said. Here it is. As towns look to plan for their children's summer activities, we're hearing that numbers are going up in children. What are your thoughts on youth sports and summer camps? And if the doctors could also speak to, now that the vaccination process is opened up to teenagers 16 and over, if you could just provide some context and some information around parents who may be hesitant to get their child vaccinated as we move toward the summer.
Thank you for that question. I'll take the second part. Definitely vaccine, the Pfizer vaccine in particular, is available for children that are 16 and 17 and 18 years old. And The vaccine in and of it is safe. The vaccine is safe. It is effective in older adolescents, 16 and 17. The studies are now taking place, the clinical trials, in children now as young as 6 months of age. And most likely we will see the Pfizer vaccine be authorized for use in children 12 years to 16 years of age very shortly. In regards to what we know about COVID-19 in children, children are, as we saw, less likely to get COVID-19 in terms of the cases. We see less cases in children. However, children can get COVID-19. And we see a disproportionate impact of COVID-19 on Black and also Latinx children in particular. So highly encourage children getting vaccinated, 16 and 17-year-olds. In regards to the parent that has questions, which is natural. I think people are going to have questions regarding vaccination. My recommendation is speak with your doctor, speak with your child's pediatrician, someone that you trust, that you know is going to provide you the information. The vaccine is safe, it is effective, and also the vaccine is going to protect your child from COVID-19. We talked about those long-term effects that can take place. And as things are opening up, you want your child to be protected from COVID-19 disease. In regards to plans for the summer activities, thoughts on youth sports and summer camps, socialization is important. We definitely want children to socialize, to have active social lives. And what in terms of the recommendations are really following the guidance. Things are opening up, schools are opening up, but we have to continue even through our summer camps. The same guidance is going to be in place. So ensuring that the summer camp that your child is going to is enforcing masking, is enforcing social distancing, is having cleanings and disinfection in place. That is truly the recommendation. But definitely making sure that you are vetting the summer camp. But socialization is important. Schools are opening up, our summer camps are opening up, and making sure, however, that while that's taking place, we're continuing with our mitigation measures, our safety measures, and then also getting your child vaccinated. Because when they go to summer camp, when they go to school, when they're around their community, the vaccination is what is going to protect them from COVID-19 disease.
Thank you, Dr. McDowell. I know, Dr. Lewis-Singh, this has been a topic that has been on the forefront of your mind and that I've heard you talk about a lot. Do you have anything to add to that discussion?
Just a few points. I think Dr. McDowell really hit on a number of comprehensive points. I would add testing as something to make sure that as you're talking to those summer camps and those programs, you're understanding what their testing plan is. Some of the best programs that I've seen have a rigorous plan where they are testing students on a recurring basis. So they're not waiting for an event to happen. They actually have, as a part of their sports program or their camp activities, actual structures where they are actually working with their local health department to make sure that they are doing tests, not just for the students, but also for the staff. Another thing to consider, because testing is so important, is whether or not your child would be comfortable being able to have that test administered. And I think that's a big consideration if you are thinking about putting your child in a program, especially for some of the younger ones. I know some of my friends, their 5- and 7-year-olds are now getting in the habit of swabbing to be able to test, but that's going to be so important as they begin to do these activities, because they will be there for a number of hours and they will be exposed to other people. So until the vaccine is available for them, making sure that that is a rigorous and robust program and that you are comfortable with the level of rigor that is instituted in that program consistently.
Got it. We're going to stay on you real quick, and then Derek, if you could grab a question or two, really good question from the audience. But I have one quick question for you, Dr. Lewis-Singh. I mean, being at the forefront of pandemics and your background, and knowing how there's been a disproportionate impact, particularly on communities of color. We kind of talked about that area. Has the medical community learned from this experience? As a son of Tuskegee, as a person who studied history around the impact of medicine, particularly on Black communities, and then even, talking about some of the things at Johns Hopkins, have we finally learned from this experience? Are things now in place that we won't have to constantly talk about disaggregating data and understanding and knowing how in the midst of a crisis, how certain medical issues are affecting certain people? Can you talk to us about that real quick? And maybe we haven't learned anything. Maybe it's still to be determined. I don't know, but I'm just wondering from your vantage point if you've seen stuff.
So I've seen that we've learned some things, but I think we have a lot of work to do. One of the things that a lot of my colleagues hear me say is it's not health equity, it's equity, right? So when we talk about equity in all policies, it's not enough for us to say, oh, we're talking about health equity for public health people in this corner. Equity is equity is equity, which means that if we're going to actually tackle these issues, we have to look at it holistically, which means we need that understanding of investment and history. And the fact that where people live still determines their life expectancy is an equity issue. So I think that's resonating in the minds of business owners, for example. There are Fortune 50 companies that are talking about equity as a central tenet of their business, because they realize it's not just about the people that are in the corporate office, it's about the people that are on their front line, which may be their cash registers, and understanding how they live and how they protect them, which has been born to bear in this pandemic. But I think the other thing that we're seeing, at least in the conversations I'm having every day, are around how we invest to make sure that this pandemic doesn't continue to disproportionately impact people, because what we're seeing is that it's COVID-19 today, but it could be a hurricane tomorrow. It could be a large-scale terrorist event. It could be a wildfire in California. And the reality is that all of those events also disproportionately impact people of color. And so when we're thinking about how we invest in preparing for disasters, I think there's a shift there. But I think the other part that we're seeing is the role of political leadership. So when you're thinking about how we actually got to a place of disaggregating data, and when we started to say we need to standardize the data that we're collecting, and we need to be on the same page about collecting data nationally in a harmonized fashion so that we can actually understand who is being impacted disproportionately, and using more than just fatality. So often in disasters, our primary health outcome is fatality, which means that after Hurricane Maria, people were so focused on how many people died that we didn't think about the health impacts for those who lived. We need more measures of health outcomes and equity outcomes in a disaster, and I think that's the part we're still struggling to get to. But what I've been really heartened by is understanding that political leaders are seeing that they have a role in disasters. People will often tell you that, well, it's for the subject matter experts, but there's a big role that our political leaders have to play in making sure that we have those systems and that infrastructure that allows for us to do that work of collecting the data and making decisions based off of the data and the data alone.
No, thank you for that response. I think that was spot on. Derek, turning over to, I don't want to ask all the questions. Do we have a couple good questions that we could throw out there?
We have one more good question, and we
all
got a hard stop in 4 minutes. Johnson &
Johnson. We got more like 6 minutes. Come on.
All right, we're at the W. Fresh mark. Okay. So, for those who are in my age bracket, Johnson & Johnson has been in the news because of the mishaps with their vaccination process, as well as the news today released. So the question came from one of our audience members: what should we, or more specifically, the medical professionals on this panel, say to help alleviate concerns of those that were already skeptical of taking the vaccination?
All right, who's going to jump out there?
Yeah, no,
there we go. Go ahead.
This is, and by the way, the colleagues on this have done a phenomenal job. We're recognizing, promoting, talking about science isn't just, you just drop objective facts and call it a day. You have to work in kind of the socio-historical context of every community, in addition to just kind of also translating it in a manner that aligns with someone's beliefs, their priorities, who they are as a person. That's what science has to do in order to kind of reaffirm itself as a public trust. So from my standpoint, hearing about Johnson & Johnson, a couple of things that come to mind, hopefully to provide some comfort to anyone listening to this. Keep in mind, this vaccine was studied close to 50,000 human beings across the globe, and the high population of Hispanic Latinos and African Americans in comparison to Pfizer and Moderna, or just any other kind of intervention from a medical standpoint. Great diversity Johnson & Johnson had. With that said, it did discuss it had rates of blood clotting. They were low, very low, and they felt that was good enough to say the risks far outweigh the benefit. And keep in mind, that's what we do as human beings. I always tell my students, if you never want to get into a car accident, you never drive a car. But the second you get into it, you raise your probability low enough that the benefit far outweighs the risk. From my standpoint, the halt of the Johnson & Johnson is appropriate so we can have the proper public health messaging and education to remind our citizens, our Baltimore City, the risk is still very low. It is incredibly low. Oral contraceptives that women discuss with their doctors every day to take 3 to 4 times raise their risk of getting blood clots versus the general population. So from my standpoint, we need to take a page out of those kind of conversations and discuss the rates are so low. Let me provide you some comfort with the numbers. Let's discuss how it would affect you and why you would also be a low risk for developing this. That's it. From my standpoint, this necessitates colleagues like on this panel to continue having the medical education to comfort our citizens. It is fine to be skeptical. I think you just need to be able to have a to talk to people to have this proper information.
Well, I want to thank each and every one of our panelists. We're going to, wrap up at this point. There's never enough time for all the questions I have trapped in my brain, nor the questions that we kind of get from the listening audience, because that means how important this topic is. I thank each and every one of you again for taking time out of your schedule. I'm going to close it out, but first I would like to throw it over to Dr. McDowell. If you could put out any city-specific websites, any specific information that we want folks to go read up, but then also spread it in their communities like a germ. Could you do that for us real quick?
Yes, definitely. Thank you for the opportunity for me as a representative of the health department to be on the call and
you are the chief medical. You're the chief medical person for the city.
Yes. So
taking the time out for us.
Definitely. Big pieces again. The vaccine is here. We want Baltimore City residents to get vaccinated if they choose and to have the information that they need to make decisions. Please go to COVAX, that's COVAX, period, and I'll drop in the chat, COVAX, COVAX, period, baltimorecity.gov, COVAX.baltimorecity.gov. Share that with your families, with your coworkers, with everyone in your network. That is the vaccination site where you can go up and sign up for an appointment. You will be able to get an appointment if you go to covax.baltimorecity.gov. In addition, I do want to highlight our MAP hotline.
10 seconds.
Our MAP hotline number, individuals can sign up there at 410-396-CARE, C-A-R-E, 410-396-CARE. Go on that if you're 60 and older to get an appointment, or if you have a person with a disability, you live with someone that's older or has a disability, please go call and we will assist you in making an appointment.
Well, we don't want to get cut off by the hard stop at TV 25. So Baltimore, thank you for tuning in. This was a very important discussion. We had some amazing information shared by great subject matter experts who absolutely care about you. Please take this information and spread it to your communities. Be more, expect more. Thank you for tuning in, and we have to do this again. Bye.